All right, today we are going to show you the half pigeon stretch, okay? The times that we would need this, or the people who would benefit most from this, are oftentimes going to be not just runners and the people who are flexing. So the people in track and the people that are running outside absolutely are gonna have tighter hip flexors. But it's also gonna be people that are sitting at a desk and sitting there for 8 hours a day. Because if you think about it, if you're sitting there with this leg flex for 8 hours a day, then we're going to cause hypertonicity or tightness in those psoas. One of the main things that we wanna look at is I can show you really quick how we would check for this. So I'll have Courtney go ahead and lay on the ground. So it's really, really simple. You just have someone lay on the ground. You're gonna ask them for their hands. You'll grab at the wrist, and then you'll just pull slightly towards you, bring their hands together, bring them up so that you can see. So leave your hands like that, go ahead and stand up. I know, hard. And I want her to show you what it looks like. So I want her to come closer to the camera, and I want her to show how her fingers are. So if you look, you can see this left hand here on this side is shorter than the right. So what that tells us is that tells us that she has hypertonicity or tightening in the left psoas. This can also be something that is an issue for women who cross their legs. If you don't already know this, I am absolutely anti-leg crossing. If you come in here and your leg is crossed, I will ask you to fix it, okay? I won't tell you because I don't feel like that's nice. But I'll say, hey, your leg's crossed, because women will sit like this, and if you look at the pelvis when we do that, it causes a tilting or rotation of the pelvis, which will absolutely contribute to tightening of that psoas. So we absolutely don't want to do that. It also affects your QL and other muscles, so we can get into that in another video. But for specifically this half pigeon is really helpful in addressing psoas, hypertonicity, or tightening, okay? So what I want Courtney to do is I want Courtney to go ahead and get into this pose. What we're gonna do is she's gonna take her right leg and she's gonna bend it to where her leg is gonna be like this, and then that left leg is gonna go straight back, okay? One thing I want you to realize is there's a couple of things you wanna note here. One is that the closer that the foot is to your straight leg or extended leg, the easier this stretch is gonna be. The further away that foot is, and she can try to bring that forward a little bit, the harder this stretch is gonna be. If you do want to increase the intensity of the stretch, one thing I like for you to do in order to make sure that we are protecting the knee is that she'll actually take this hand and press the knee to the ground and then lift that foot to move it, okay? This is especially important for someone who potentially has previous knee injuries. The last thing we want to do is try to just move that foot because it can cause strain and stress on that knee and you'll have a really hard time getting up, honestly. One of the main things I want you to do is I want you to first get into position. Then I want her to try to drop down either to her forearms or all the way down if she can in order to be able to get a really good stretch for that. One of the main things I want you to be sure of, so this is either you're gonna need a helper or you can just be aware of this yourself, is you wanna make sure that the pelvis is level, okay? So she is just a little high here, I would have her just a little turn. So barely, barely, barely modified. And you can ask, hey, did you notice a difference in that? And almost every time the person is gonna say yes, because that 1/16 of a difference, that 1/32 of a difference really does make a difference in how we're targeting that muscle to let go. One of the biggest things I want you to do while you're doing this as well is I want you to focus on your breathing. Your breathing is what is going to help you get the most out of this stretch. This stretch is not one that you want to try to rush through. This is one that we really want to try to be relaxed, and we want to do it low and slow like a nice Texas brisket, okay? So what we want to do is you want to breathe in through your nose and out through your mouth. With every breath out, I want you to try to soften a little bit more in that stretch, get a little bit more length out of that muscle. You should feel it not only in the hip flexor of the leg that is extended or pushed back, but you should also feel it in the opposite side glute and IT band of that bent leg, okay? I want her to go ahead and switch to that other side. You always want to make sure that you're stretching both sides regardless of what side was short, okay? So we have that left side that was short on Courtney, but we still are going to have her do it on the right as well because you always stretch both sides. We are a balanced individual. That's just what we do, okay? The reason why this stretch is so important and why it's really important to address issues in the psoas is because the psoas is a very, very important muscle for several reasons. If you talk to some people, they'll tell you it's really, really important because of the emotional component to the psoas. If you don't know that, look it up. Some really great information out there. The other thing is that it attaches from the lateral aspect of the hip, and then it comes up and attaches to the anterior or front part of our lumbar vertebrae. It is also the only muscle that attaches directly to the disc as well. So if we have tightening in that psoas, especially on a unilateral or one side, it's going to contribute to pulling that lumbar spine in that direction and increasing our lordosis, which is the natural curve in the low back. We definitely don't want to do that because it can cause major issues for us, okay? We want to make sure that we are addressing hypertonicity in this muscle regardless of whether it is on one side or both. If it's on one side, you're absolutely at a higher risk of injury. But if it's on both sides, you're still at a risk for injury, just not as high, because what it's going to do is it's going to increase your hyperlordosis, okay? So you see those people that have like those Buddha bellies that are sticking out? It's from an increased hyperlordosis. And what I always like to remind women is that I'm pretty sure, none of us need help in that area as far as having a protruding belly, right? We're all trying to work against that. Strengthening your glutes is a great way to do that, but that'll be a separate video from here. So whenever she comes up, I'm going to have her come up. She'll get out of that stretch. And I want her to go ahead and lay on her back again. I want to retest real fast, and let's see if we made an improvement. A really great way that we can help with this as well is that we can work on hydration. Perfect. So she's not perfect. I want her to come up and show you, but we're definitely improved. So she went from here to there. So we do have a little lengthening or stretching in that muscle. One last thing I wanted to say is that the psoas is really important too. So you have what's called a psoas major and a psoas minor, which means that there's different parts to that muscle. But if you look at literature, there's some literature that says that extension of it will actually come up into the diaphragm. The diaphragm is what we use to breathe, okay? So those are a muscle that allows for us to have passive air brought into our lungs. If we have tension in the diaphragm, you're going to have a harder time breathing. You're gonna have shallower breathing. It's gonna be harder for you to take deep breaths, and it will just affect your overall vital capacity is what it's called. So it's the amount of air you're able to bring in. If you have less air that you're bringing in, you have less oxygenation for your tissues. It is this whole downward spiral, all from a tight muscle. So is it that big of a deal for you to really do a half pigeon and be focused on it? Absolutely. And for many, many different reasons. Your body is completely connected. It is one big unit. So start small with these little stretches and really relax into it. In an ideal world, I want you to do this for 3 to 5 minutes. So really get cozy, put on some nice music or a podcast you want to listen to, whatever it is, and allow yourself that time once or twice a day to just really relax and rest into that posture. Allow for that stretch. Again, like I said, if you could be hydrated prior to doing that, it's going to make this even more effective. But in an ideal world, I want you to be hydrated all day, every day, so that no matter when you do this stretch, you're ready for it.